Hi, I'm Dr. Stephanie Giammittorio, marathon runner, triathlete, and fellowship-trained sports medicine physician with Riverside Orthopedic and sports medicine specialist in Newport News in Williamsburg. Today, I'm with John LaRue, the Director of Sports Physical Therapy and Performance at Riverside, and we are here to discuss a specific condition called runner's knee.
Hi, my name is John LaRue. I'm the Director of Sports Physical Therapy and Performance at Riverside.
We're excited to give you an overview of how we treat runner's knee, as well as many other sports-related injuries in Riverside's state-of-the-art multidisciplinary sports medicine program. It's a combination of medical expertise, physical therapy, and sports performance training. Then we will close with a variety of marathon running tips I'd like to share with you. So thanks for tuning in, and I hope you will find this information useful. Today, I'd like to talk about runner's knee, a common condition which affects more than 200,000 runners per year. Over the course of this video, I'm going to discuss the causes, related symptoms, type of pain, and treatments, as well as return to running and prevention pearls for runner's knee. Runner's knee is also known as patellofemoral pain. So first, I wanted to go over some anatomy of the patellofemoral joint. The knee joint is made up of the femur, or your thigh bone, and your tibia, or your shin bone. They come together and they form what we call a hinge joint, where the knee bends and extends. The kneecap sits in front of the femur in its own joint, and it sits in this groove in front of the femur that we call the patellofemoral joint that you can see pictured on these images here. It's held in place by different muscles and tendons, and it moves up and down in that groove when we do activities such as running, bending, squatting, and going up and down stairs. So what causes patellofemoral pain? It actually is multifactorial. So there's a lot of different reasons that it can occur, and it can be from a combination of different factors as well. It also can vary from person to person. But overall, what happens is that there's a biomechanical change in the normal alignment of the kneecap, where it does not glide properly in the groove. So in the picture here, you can see that it's supposed to glide up and down in that groove, but what happens is that it kind of has a tilt to the outside of the groove. It doesn't actually dislocate, but it comes out more to the lateral edge of the groove where it's sitting. Now I'd like to go over some of the risk factors that can contribute to runner's knee. One of them would just be naturally having a hyper or hypomobile kneecap so that it's not riding up and down in that groove properly. Another big one is if someone has a knock-knee, or what we call valgus alignment at the knee. You can see on the pictures here the normal alignment of the hips, knees, and the feet on the far left. On the far right, we have a picture of what a valgus alignment or knock-knee alignment looks like. So there's a bigger angle between the hips and the knees. This can lead to extra pressure through the patellofemoral joint and cause the kneecap to ride on the outer part of the groove. This is really common in females because we have broader hips, which creates that bigger hip-to-knee ratio. Another big issue, especially in runners, is gluteus medius weakness. This muscle is up around our hips, and it helps keep the hips and pelvis stable while we're running. So if it becomes weak, it can allow a little bit of some sway in the pelvis that can lead to that knock-knee type position and increased pain at the patellofemoral joint. Sometimes people may just naturally have an increased hip rotation as well too that can lead to runner's knee. Quad weakness can also lead to runner's knee too, because as you saw in the previous picture, the quad muscle and tendon insert on the kneecap. So if it's weak, then it allows some extra motion at the patellofemoral joint. Leg length discrepancy, no matter what the cause of it, can lead to extra pain through the patellofemoral joint as well. Another frequent cause may be flat feet, where your inner arch in the foot may drop in a little bit, causing the athlete or runner to, again, have more of that knock-knee type position and increasing the pressure through the patellofemoral joint. Also, abrupt increase or recent change in activity can lead to pain in the patellofemoral joint as well, too. Next, I want to go over some symptoms that you may experience with runner's knee. The symptoms may come on gradually or come on suddenly, and most patients will complain about pain around or behind the kneecap. And it may occur with activities like prolonged sitting, squatting, going up and down stairs, running, jumping, or kneeling. Patients may also complain of a giving away sensation secondary to this pain. They also frequently mention popping and clicking, or what we call crepitus, behind and around the kneecap, and some may even experience swelling in the knee too. So, how we diagnose runner's knee is largely based on history and physical exam. When you come into the office, we will palpate around the knee, and we will often find tenderness around the patella. We'll also look at the alignment between the hip, knee, and the foot. In these pictures here, you can see the normal alignment on the left side. We'll have you stand on one leg and do what we call a single leg squat, and we want to see it look like the picture on the left. However, really frequently, we will see the hip kind of sag down and the knee start to go into that knock-knee position. This is all a sign of weakness around the hip muscles. We'll also evaluate the whole lower extremity to see if there's any atrophy of some of the muscles. We will check flexibility, and especially in runners, checking hamstring and IT band flexibility. We'll also take a look at how the patella is moving and tracking in the groove. We'll also look for quad and hip weakness with manual muscle testing. X-rays are not required for the diagnosis of runner's knee, but they do help us look at some structural causes of it, as well as help us rule out some other causes of knee pain. In the pictures here, the bottom one is what we call a lateral view, where the patient is standing sideways. The red circle shows where the patellofemoral joint should normally sit, and sometimes we may see that it sits a little bit higher or a little bit lower, and this can make someone more prone to develop runner's knee. The top picture is what we call a sunrise view, where we can see how the kneecap sits in the groove in front of the femur. So we can look to see if the sulcus might be a little more shallow than normal, or if the patella is slightly subluxed out to the side. Again, it's not dislocated, but we can see that there's a little bit of a tilt sitting in that groove. Once we've made the diagnosis, there are a lot of different treatment options for runner's knees. First, we'll start with activity modification. You don't have to completely be inactive, but it is important to reduce the activities that lead to these symptoms. So you can still participate in alternate exercises or cross-training like pool running, swimming, biking, or elliptical. You may even be able to continue to run, but you might have to reduce some factors that increase the pain. So you could run at a slower pace or a flatter surface or a shorter time or distance, as long as it's not increasing your pain. However, if even the shorter distances do increase the pain, it still is important to take some time and rest. If you continue to experience pain, you could try ice and anti-inflammatories. And anti-inflammatories could be taken in the form of over-the-counter medications such as Advil or Aleve, or you could try some topical anti-inflammatory like Voltaren gel, which is shown below. If for some reason the over-the-counter medications don't help, we do have other prescription-level anti-inflammatories that we can prescribe for you to help with some of the higher-level pain. We may also prescribe what we call a patellar stabilizing brace. As you can see in this picture here, the idea behind it is that there is some extra padding and cushioning on the outer part of the patella to help stabilize it in the groove. And we'll usually start with this early on in treatment, but as you continue to progress and improve, have you start to wean out of it so that you don't start to rely on the brace too much. It's also important to take a look at your footwear and your running shoes. You want to make sure that you're in the right shoe for you, that it's comfortable, and that it's not too worn. I usually recommend switching out your shoe wear every 300 miles. You also may want to consider some inserts in the shoes as well. The most important treatment for runner's knee is participating in sports physical therapy. So next I'll hand it over to John LaRue, our Director of Sports Physical Therapy and Performance with Riverside.
As Dr. Giammittorio mentioned, sports physical therapy can be a useful treatment approach to the diagnosis of runner's knee. Some of our major goals in sports physical therapy will be to treat both strength and flexibility of the athlete. For strength, we often like to work on proximal joints, such as the hips, to work on posterior chain strength, as well as quad strength. For flexibility, we like to address both the soft tissue flexibility as well as the joint mobility of the runner. If we can work on hip mobility, we often can decrease the stress on the anterior runner's knee. In addition, we like to work on balance and coordination, as well as sport-specific movement to help that runner get back into running in a safe manner. Various exercises can assist in the treatment of runner's knee. A lot of these will include both body weight as well as externally loaded exercises with barbells or hex bars, for example. These exercises here will help work on hip strength, especially of the gluteus medius, as Dr. Giammittorio alluded to earlier in the presentation. In addition, these exercises will work on quadricep strength, both against gravity as well as focusing on motor recruitment of the muscle. Impactful exercises could include activities such as single leg RDLs to work on posterior chain strength, as well as exercises against gravity, such as those you see on the slide here that include bilateral leg bridges, as well as single leg balance to improve gluteal medius strength.
Thanks, John, for all that information. Physical therapy is really the most important treatment for runner's knee. It's also important for runners to do some of these exercises even if you aren't experiencing some of these symptoms, because it can help prevent runner's knee from occurring in the first place. However, if for some reason you're not getting enough relief with the physical therapy and other treatments, we can consider doing injections into the joint as well, too. I do all of my injections underneath ultrasound guidance, which you can see pictured on the bottom here. The ultrasound helps us give extra accuracy into the joint, as well as gives us a visual to see if there's any swelling that needs to be drained too. We'll usually start with doing a steroid injection, also known as cortisone injection. And this is a high-dose anti-inflammatory medication that gets injected into the joint. We can also consider what we call viscosupplementation or gel injections. These are injections that are made up of hyaluronic acid that help cushion and lubricate the joint to help it move more fluidly. These do have to get approved by insurances first, and they usually like to see that you've tried the steroid injection and physical therapy first. Once we get authorization, they're injected in the same way as the steroid underneath the ultrasound guidance. We can also consider doing what we call platelet-rich plasma injections as well. Unfortunately, these ones are not covered by the insurance and do require an out-of-pocket expense, but we do have them available at our Newport News office. And what we do with those is we draw your own blood, spin it down in a centrifuge, and then we pull the platelets out of the blood and inject platelets back into the knee joint. The idea is that the platelets release a high concentration of growth and healing factors throughout the joint. Now that you've completed your treatment and you're ready to get back to run, I wanted to share some return to running pearls with you. It's really important to start to incorporate a dynamic warm-up and cool-down in your exercise routine. We want you moving while you're warming up, not standing still. So, for example, you could do some light walking, light jogging, do some butt kicks, high knees, walking lunges, karaokes, all things that get the muscles moving and stretched at the same time. A dynamic cool down would include, again, just light walking or running at a slower pace. And then after that, it can be followed by more of static stretching where you're standing still to stretch the muscles. As you're getting back to running, it's a good idea to try to start with some run-walk intervals first. So you can do this based off of time or off of distance. So for example, you could start with just 1 minute running, 4 minute walking. You may want to try something like running a quarter mile, then walking a quarter mile. Try to find the pattern that works for you and gets you back up and moving without any pain. It's also important to avoid running on back-to-back days. You really want to incorporate and include some cross-training in your return to running. So continuing doing some swimming, biking, elliptical, something that still keeps your cardiovascular system going without as much pounding. And it's extremely important to continue doing all the strength training that you did during physical therapy. Even if the pain has decreased, we still want you to do these exercises because we don't want those muscles to atrophy. Once you're ready to progress, it's important to only change one variable at a time. So you could work on changing your speed or the intensity of your run. You could change the grade, which is the incline or the decline that you're running on. Or you could change the time or distance that you're running. We don't want you going back full force and saying, since I feel good, I'm going to go back and now I'm going to run uphill at a faster speed for a longer distance. We want you to only take one variable at a time to make sure that that pain doesn't return. It's also important not to increase your weekly mileage by more than 10% or increase your long run by more than 2 miles at a time. It's okay to continue to progress even if you have a little bit of some low-level pain, as long as it's not going above 3 out of 10. So on the scale of 1 to 10, with 1 being the least amount of pain and 10 being the worst, I usually use 4 as the cutoff. If the pain is increasing above 4 out of 10, then that's a sign that you may need to modify some of these variables so the pain lessens. You don't have to completely stop running, but you just need to back off on one of those variables so that the pain goes back to a tolerable level. It's also important to look at your gait pattern as well too. If you notice that you're limping, you may need to decrease some of those activities or modify again so that your gait pattern is normal. So hopefully if you follow these return to running pearls and continue with your strengthening, this will get you back up and running. A lot of these return to running tips can be used to even prevent runner's knee from occurring in the first place. Again, it's really important to do some of these strengthening exercises with physical therapy and follow some of these pearls to get you back up and running. And now I'm going to hand it back over to John to give you some more information about Riverside's sports physical therapy program.
Thanks for watching Dr. Giammittorio's presentation on runner's knee. She presented some great information so that best case, you can work to prevent developing runner's knee yourself, or if you need to seek out medical advice, you have a starting point for your discussion when you visit with a sports medicine provider. Next up are 3 videos about Riverside's sports physical therapy program, our new sports medicine physical therapy space, and our sports performance in research lab. Hi, I'm John LaRue. I'm the Director of Sports Physical Therapy and Performance for Riverside Sports Physical Therapy. Riverside Sports Physical Therapy is a segment of the comprehensive program offerings at Riverside Sports Medicine. Our services include individualized rehab after an injury or after surgery. These include training for a 5K or getting injured on the field. We want to work with you to ensure that you're able to return to function safely at the highest performance possible. Other services that we provide include functional testing to return to sport, as well as performance training that's once again individualized to what you're looking for, whether it be improving strength, power, speed, or agility. We want to work with you to ensure that you return to the field in a safe and high-performing nature. Our sports physical therapy team includes board-certified sports physical therapists that have been residency trained in sports medicine to deliver the highest quality of care to our patients. Our sports physical therapists work with our certified athletic trainers and physicians to deliver a comprehensive clinical approach to our patients. An example of our comprehensive sports medicine program includes a high school runner who is injured on the track. The runner is going to work with our certified athletic trainer to discover what's injured, and from there be referred to our orthopedic physicians to root out the cause of diagnosis. From there, the patient is often referred to us in sports physical therapy to address any suboptimal weaknesses, strength, power, and perform functional testing to return that athlete back to sport in a safe manner. When looking for a quality program, you want to look for one that evaluates you at the point of injury and helps you return back to sport functionally in a safe manner. At Riverside Sports Physical Therapy, we offer this comprehensive level of care to get you back to the playing field. Riverside Sports Physical Therapy, we're here for you. The physical therapy location provided here in sports medicine is extremely unique because it has to meet the demands of the athletes that we serve. This includes increased square footage to perform functional activities like jumping, running, and cutting, as well as the use of different pieces of equipment that you normally would find in a gym for training or in a professional or collegiate setting, which includes squat racks, specialized treadmills, functional rig systems that allow you to do hanging exercises and really appeal to a tactical-based athlete. So this facility does a lot of different things that a typical traditional physical therapy location in an outpatient setting might not be able to do to meet the demands of those athletes. In addition, we have the performance turf, which allows the athlete to mimic the demands of the field in which they're participating in, which includes cutting in a certain direction, acceleration, deceleration. So we really feel that the increased space and uniqueness of that space allows the athlete to succeed and be able to rehabilitate in a way that allows them to return to sport. So our sports physical therapy team includes board-certified sports physical therapists that specialize in the care of athletes. In addition, we are able to work with our physicians and our athletic trainers that work with our patients in the actual clinics themselves. So we really feel that we can cater to creating this team environment to the patient. And I think it's really important that our clinic almost facilitates like an athletic treatment room as opposed to
a more traditional physical therapy clinic where we're able to have patients use the treatment tables and then go into the functional space and then go into the turf. Outside of using the equipment in the facility for exercise, there's a vast amount of treatment approaches that we take with our patients. This includes the use of myofascial dry needling. We use performance technology such as force plates to look at the distribution of weight, as well as running analysis that we can perform on our treadmill and display on a TV for the patient to be able to see. In addition, we have access to TheraBody products, which are a recovery-based product solution that incorporates the use of percussive massage guns, as well as recovery boots that a patient can use after their treatment or in between treatments as a form of recovery, which is really important to our patients that are actively participating in sports or in events and are rehabbing concurrently at the same time. So this facility basically ties together sports physical therapy and the continuum of care we have with our physicians, where we truly believe that the level of care that you're receiving in this facility mimics that of a high-level collegiate or professional setting, which includes the different expertise that we have in different sports, technology we have available to patient, equipment we have available to patient, and the integration of our physicians with our patients and our providers that really allows the patient to feel as if there's a team approach to their care and one that they feel that they can accelerate to their highest level of potential. Sports performance is a branch of our physical therapy services in sports medicine. This includes the continuation of rehab service to the return to sport timeframe. This can include improving strength, power, speed, quickness, or any other individualized goal that an athlete's looking for. Even if they're coming from physical therapy or they just want to be able to work on certain goals for their active lifestyle, they have a place here to work on those with our certified strength and conditioning specialists, who we're referring to as our performance coaches. These individuals will work with our patients on an individualized basis or in small group settings. This can include working on certain goals that you may have that we can measure over time, whether it be your strength or range of motion, or this can include small groups that focus on a youth sport such as baseball or football, or even working on skills such as using a barbell or performing performance-based exercise and improvements with some of the equipment that we have here on site, which includes both our functional physical therapy location as well as our performance turf space. Some of the pieces of equipment and technology that we have in our facility include our large performance turf area, which allows the athletes to perform plyometrics such as jumps and landings, and working on those mechanics that they would following injury where they might have a deficit in that ability. We also have access to our functional training area where we can perform complex weight movements as well as perform running analysis that allows us to break down the mechanics of your run to optimize the performance. Our sports performance and research lab area here on our performance turf is also going to be the home to a lot of the research that we're performing in our physical therapy department, as well as with our orthopedic and sports medicine providers. Sports performance care is for athletes of any age, skill level, and desire to participate in sports. This can include a youth athlete working to improve their strength following an injury, to an active older adult who's looking to return back to walking every single day. The performance specialist is going to work with that athlete on an individualized basis to accomplish their goals, whatever they are. There's a close relationship between sports performance and sports physical therapy. If you're an athlete who's in sports physical therapy and now you're taking part in sports performance sessions, there's a hand-in-hand relationship between the two providers to ensure that your goals are being met. For example, if you're a basketball player completing your rehab from an ACL surgery, oftentimes sports physical therapy in itself is not enough. Working with our sports performance specialist, you'll develop the skills such as power, strength, speed, and your ability to change directions in a much more competent manner to get you back to the court at the level you were prior to injury. Whether you're a high-level athlete or an active individual, our sports performance specialist will work with you on an individual basis to create a plan for you to meet your goals to reach optimal performance.
Welcome back. I hope you found all that information helpful. Riverside's multidiscipline sports medicine program helps athletes of all skill levels, from the novice weekend warrior to the seasoned marathon runner, from the middle school athlete to the professional athlete. Next up for you are 4 training tip videos I created for marathon runners. I'm Dr. Stephanie Giammittorio, sports medicine physician with Riverside, and here are some tips for training for a marathon. So I usually recommend doing some type of dynamic warm-up before exercising, so doing things like butt kicks, high knees, walking lunges, karaoke, light jogging to kind of get the blood flowing. Then afterwards doing more of a static stretching after completing your exercise. Then also making sure you incorporate some strengthening as well into your training, especially in runners. Doing a lot of glute strengthening really can help prevent injuries in the lower extremities. I'm Dr. Stephanie Giammittorio, sports medicine physician with Riverside, and here are some tips for training for a marathon. Start low and go slow, so do what's comfortable for you, and then slowly increase your distance, time that you're running, slowly increase any type of incline or hill, but only adjust these variables one at a time. My rule of thumb, you only want to increase your weekly mileage by 10% per week. I'm Dr. Stephanie Giammittorio, sports medicine physician with Riverside, and here are some tips for training for a marathon. I would highly recommend using a coach to help kind of work out your weekly routine. I think it's really beneficial to have someone there supporting you and letting you, know that you are heading in the right direction. And so I would highly recommend doing group runs or finding other people to run with, because it can really push your endurance and help you improve and get stronger, as well as give you some social support. I'm Dr. Stephanie Giammittorio, sports medicine physician with Riverside, and here are some tips for training for a marathon. So usually get up, I try to eat something light beforehand. Let that digest as I'm getting ready, so make sure I have my equipment together, have the right light layers, the right shoe wear on, and give that food some time to digest before going out. Just depending on my goal for the run, whether I'm working on speed work or hill work or doing an easy run or long run, I may just go straight out from my front door and go for a run. But sometimes I'll go drive to other locations that give me a little bit more distance or give me some more hills, and try to keep me away from the traffic and cars, so stay safe.
And that concludes our 2024 One City Marathon Runners presentation. Again, Riverside is proud to be the official health and wellness sponsor of the One City Marathon.
At Riverside Sports Medicine, we specialize in the diagnosis and treatment of injuries caused by physical activity, sports, and exercise. Whether you play sports on a structured team, such as football, baseball, or soccer, or enjoy recreational sports like cycling, running, or weightlifting, you may be at risk of injury that could limit your daily and athletic functioning or future performance. Sports medicine care is available in your community. If you ever need immediate treatment, our sports medicine hotline gives you direct access to our sports medicine team. Get advice on clinical questions or ask to schedule an appointment with an orthopedic sports medicine expert. Call 757-534-6767. Thanks for watching.